Hello, welcome once again to today's lecture, and we're on the section C of our Model 1. For today, we'll be looking at the topic Health Service Environment. My name is Fam McBequin, a lecturer from Excellence Health College. Now, for today's overview, we are going to look at the scope of the health service environment. We also look at the Ghana Health Service. Then we'll discuss about the healthcare teams and what they do, the main types. The last section would concentrate on organizational structure of the Ghana Health Service. Okay. First of all, let's look at the scope of the health service environment. Health service environment refers to all groups that play a role in ensuring that the client gets the best of information and care concerning their health. The pharmacy cannot play this role in isolation without the other groups. Now, this is very important because when somebody comes to the pharmacy, either to come and buy an over-the-counter medicine or to come with their prescription, we should recognize that we are not the only group of people that we help the patient in getting well. So our care should be holistic. And that's the more reason why we want to introduce you to the health service environment. The first one that we'll be discussing in relation with the type of health care that is being provided can be classified basically into two. The first is health education or preventive health care, and the second is curative health care. Now, with the health education or preventive health care, it is very important to ensure that people are educated about their health and creating awareness on disease. In fact, if this is done very well, it will reduce the burden of diseases. Our hospitals will not be congested. People will have a healthier life. As we've always said, prevention is better than cure. So if people are healthy and they are not reporting to the hospitals, if people are healthy and they're able to go to work, it helps boost the economy. And that, as I've said, will increase the quality of healthcare that we'll be having. So health education can be seen a lot now. A lot of the radio stations are running health programs. The TV stations are also having health programs. And one that I've shown, the Vodafone Healthline, UTV, Mission One, and all the various radio stations are running it. Aside that, we have NGOs, okay, non-government organizations like Planned Parenthood, others like Ghana AIDS Commission, even Ghana Health Service is doing a lot. And I'm sure you've seen the one on hygiene, the one that came with the song Ron Safa Samina Yes and the one that also came on mosquitoes, why pregnant women and also their newborns should sleep under insecticide treated nets, the one that they sang and Tuntum Pusro. So we've seen a lot of health education going on in this country, and that is very important for us to understand. As MCAs, please know that you are also a health educator at the churches, at the mosques, and various groups. Wherever that you have the opportunity, we should constantly be telling people about healthy lifestyles, eating well, resting, drinking a lot of water, reducing on alcohol intake, stopping smoking, and not having a stressful life. Okay, all these things will help to ensure that they don't get ill. For the creative health, this involves a group that normally concentrates on diagnosing diseases, managing the diseases, or treating or preventing the diseases in the populace. And this is where we have our hospitals, our pharmacy, our Lances chemical shops, the other institutions that are structured, okay, all form under creative healthcare. So I've said, in fact, that if the creative healthcare that we have in Ghana will be very good, if we can give attention to people, it will be based on health education, all right, so that we reduce the burden of diseases in the country. So the two main healthcare that we are supposed to know is the preventive healthcare and the curative healthcare. And as I said, the preventive is always better. Now let's look at the Ministry of Health. The government of Ghana has a responsibility of providing the healthcare needs of its citizens. The government of Ghana does this through the Ministry of Health with its minister in charge. The Ministry of Health has four main responsibilities. The first one is the policy formulation. Now, when you talk about policy formulation, okay, for example, the polio policy, we have immunization policies. A lot of these policies are formulated by the Ministry of Health. Now, let's take note the Ministry of Health does not implement policies, but rather they formulate policies. The immunization program of Ghana, free maternal health care, the ACE program that we are running, tuberculosis program we are running, all these programs are formulated by the Ministry of Health and normally implemented by the Ghana Health Service. Now, the Ministry of Health has gotten a lot of agencies under them, and because of that, they are supposed to plan, coordinate, and mobilize resources for them to be able to operate. And as I've said earlier, even Pharmacy Council is under the Ministry of Health, Ghana Health Service under the Food and Drugs Authorities under the Ministry of Health. So the Ministry of Health is able to do planning, coordination, resource mobilization so that the various agencies, being it Food and Drugs Board, the Ghana Health Service, the Ghana Standards Authority, and all other organizations that falls beneath them, are coordinated well so that we have a concerted effort. The ministry performs some of its activities, especially when it has to come to healthcare delivery through the Ghana Health Service. So we say that when it comes to healthcare delivery, the Ghana Health Service is the implementing body of all the policies formulated by the Ministry of Health. Now let's take a look at the Ghana Health Service. The Ghana Health Service was established by an Act of Parliament, Act 525, 1996, with the objective of implementing approved national policies for health delivery in the country. And as I've said, these policies have been formulated by the Ministry of Health, and the Ghana Health Service implements these policies. And one is malaria control program, the guinea worm eradication program, the polio eradication program, the immunization services, okay, the 6 childhood killer diseases. All these programs are done by the Ministry of Health. Second, to manage prudently resources available for provision of health services. Okay, so the resources that the Ministry of Health gives the Ghana Health Service, like hospitals, the various machines and equipment, the cars and all those things, is the duty of the Ghana Health Service to ensure that they have been able to manage these resources prudently. The third one is they are supposed to increase access to improve health services, okay, like having the mobile clinics, public healthcare teams going around the villages, the community nurses program, and all those things are done under the Ghana Health Service to ensure that Ghanaians have access to and improved health services. Let's look at a few functions that the Ghana Health Service perform. One, they are supposed to ensure access to health services at the community, the sub-district, district, and regional levels by providing health service. And later, we are going to be talking about the primary healthcare, secondary healthcare, and tertiary healthcare, and how the Ghana Health Service is able to do it. Two, they are supposed to develop mechanisms for equitable distribution of health facilities in rural and urban areas, okay, so that we don't have hospitals and clinics only in urban areas to the detriment of rural folks where they are doing the farming and they don't even have any good hospitals. It's the duty of the Ghana Health Service to ensure that they develop mechanisms of equitable distribution of health facilities. Three, they are supposed to promote health, mode of healthy living, and good health habits to Ghanaians. Okay, and I said that this one, Ghana Health Service really have done it very well. In fact, we have seen one they've done for the maternal, the type of food that we are supposed to give newborns sleeping under ITNs. They did one on HIV/AIDS. Now the coronaviruses that we are having, there's a lot of health education going on, and it's done by the Ghana Health Service. The fourth one, they are supposed to plan, organize, and administer comprehensive health services with special emphasis on primary health care. Okay, it is important because if you're able to provide primary health care, which the providers of primary healthcare are many, it reduces significantly the impact on secondary and tertiary healthcare. And later I'll be explaining this for us to understand well. If you have a lot of cheap compounds, you have a lot of chemical shop pharmacy providing primary healthcare, then obviously we are going to have less burden on our regional hospitals and our national hospitals. The health service in Ghana can be classified into two main sectors. The first is the formal sector and the second is the informal sector. And the formal sector is made up of private and the public. When you talk about private, we have the private hospitals and all those things. Then when we talk about the public, we have the government hospitals, the polyclinics and all those things. They fall under the public hospitals. The informal sector is made up of the herbalists, the traditional medicine practitioners, the faith healers. Okay, they all fall under the informal sector. And normally I'll say that the formal sector is highly regulated as compared to the informal sector. But when we talk about the health sectors in Ghana, it's made up of the private, the formal sector, and the informal sector. The public sector health service provision is offered through a network of hospitals, clinics, health centers, and maternity homes that are organized at five main levels. Okay, so the first level is called those who provide primary care, and here is normally the community hospitals or clinic and the sub-district clinics. Okay, so the CHIP compound, okay, CHIPS compound can see in the picture. The CHIPS is CHPS. It stands for Community-Based Health Planning Services. Community-Based Health Planning Service. That's the meaning of CHIPS. Okay, so the CHIPS compound normally serves the community, and every community is supposed to have a CHIP compound. If you are sick and you go there and they are not able to help you, they refer you to a sub-district clinic. Okay, the sub-district clinic is more equipped than the CHIPS compound. The CHIPS compound normally are run by nurses. But in the sub-district hospital, you may have a medical assistant, and later I'll be talking about it as part of the medical care team. All right. Now, as I've said, these provide primary cares. They don't give comprehensive services. Also, they don't have a lot of equipment and machinery there. Okay, so they provide what we call the primary health care. Then we have the secondary services that are provided by the district and the regional levels. Okay, so if a condition comes to the community and they're not able to handle, it's referred to a district hospital. The district hospital is not able to help. The sub-district is not able to help. It's referred to a district hospital, then to a regional hospital. And the district and the regional hospital are more equipped. They are more qualified personnel and sometimes specialists. Okay, be able to do other complex surgeries. Okay, so if a condition cannot be taken care of at the primary care facilities because the condition is quite complicated and needs an expert advice, is referred to a district or a regional hospitals. And every region of Ghana should have a regional hospital. Now, the regional hospitals will also serve as referrals to our national hospitals, which provide a tertiary service. Okay, so these are the three levels. We have the primary care, we have secondary care, then we have our tertiary care. And the tertiary are normally provided by two national teaching hospitals, one in Accra, that's Korle Bu Teaching Hospital, and one in Kumasi for the northern sector, Komfo-Anokye Teaching Hospital. All right, so these teaching hospitals normally have gotten more machinery, they have gotten more qualified people who are able to help the sick. So normally we are supposed to go through this like from community and sub-district providing primary care. If their care should be above, then we come to secondary care, which is provided by district and regional. Then the last level is the national level, which is provided by Korle Bu and Komfo-Anokye. For the private sector, it comprises institutions owned by corporate and individual persons, and this include hospitals and clinics, medical laboratories, radiological laboratories, community pharmacy, lattice chemical shops, and health shops. Okay, so when it comes to the private sector, We have this there, and one example is La Paz Community Hospital, our own pharmacy. Most of them provide what we call private care. Okay, they all provide private care. So for the private hospitals that we are talking about, okay, the private sectors. So these hospitals and are all owned by individuals or corporations, and the government have no interference within it at all. However, we have another group that falls within private and government. We call them the quasi health organization. Okay, so a quasi government organization is an organization that is supported by the government but is managed privately. Such corporations created to benefit the public usually have partial government funding or any other miscellaneous support. An example is Kolebu Teaching Hospital is quasi. Okay, it's public government support but it's managed privately. Okay, the Konfanoto Teaching Hospital, Police Hospital, the um the police hospital, the 37 military hospital, Trust Hospital, Koko Clinic, and Gapuha, etc. Okay, all these organizations are classified as quasi. So we have the public purely managed by the government, we have the private, then we have the quasi organizations. Now let's look at the third lecture on our healthcare team. Health services is not provided by one person or one profession alone. That's the medical doctors. No. It involves the mixing of different roles played by different players in the health sector, all aimed at achieving the ultimate goal, that is seeking the welfare of the patient. The health service is made up of two major healthcare teams, okay, with the allied healthcare team also supporting. So the two major healthcare teams is the medical healthcare team and the pharmaceutical healthcare team. Then we have the auxiliary healthcare team, normally encompassing the allied healthcare teams that we have. For the medical healthcare team, they receive, diagnose, and prescribe, and sometimes aid in the administration of drugs to patients. Okay, and these patients are inpatients. Those that are on admission in the hospitals are called inpatients, and we have the outpatients. They normally come see the doctor and go back home again. We call them the outpatients. Okay, they also provide emergency health services. Okay, in case of accidents and all those things, is provided by the medical healthcare team. Now, it consists of the medical doctors. They normally diagnose diseases. Okay, so the diagnosis of diseases, prescribing of medicines. Sometimes they administer medicines and they perform surgeries. Okay, there are a lot of specialists that these doctors are. Okay, we have surgeons, those who operate. Then we have the physician specialists. Okay, very, very good in diagnosing of diseases. Then we have the pediatrician. Pediatrician normally takes care of children up to teenagers. Okay, it's the pediatrician that works. Then we have the ophthalmologist. Okay, they normally take a look at the eye disorders. Okay, it's done by an ophthalmologist. Then we have the dermatologist. Okay, dermatologists normally look at the skin, the hair, and the nails. Then we have the gynecologist. Okay, for female reproductive health. We have the obstetrician, takes care of the pregnant woman and their newborn. Okay, that's an obstetrician. We have a urologist. Urologist is normally a cancer specialist or a cancer doctor. Then you have an oncologist. Urologist, sorry, takes care of the urinary tract. That's urologist, sorry. So the male reproductive tract and urinary system is urologist, and an oncologist take care of cancer patients. That's an oncologist. So basically, we have the doctors' various specialties, okay, and you can name more. The doctors normally have a group of people that also assist them, and sometimes in cases where there's no doctor, you see them. We call them the medical or physician assistants. So they assist the medical doctors in their duties of diagnosing and prescribing medicines for the treatment of diseases. They head the medical healthcare team in towns and villages where there are no doctors, and that we talked about it earlier on. So where they are providing primary care, most of it are not. You may see the medical assistants, sometimes called simply MAs. Okay. The nurses also are very important because they always stay by the patient. They receive and attend to patients, aid in administration of medicines, take the patient's vital records, offers other psychological aids to patients. They spend most time with patients, okay, monitoring the patient and assisting medical officers. The head of the medical healthcare team normally is the medical superintendent or the director, okay, of the team. He is normally the head of the team. Take a look at the pharmaceutical healthcare team. Now, the pharmaceutical healthcare team is the first point of call in the community. Now, what this means that most often than not, when somebody is sick in the community, the first place normally that they will go is the community pharmacy. Okay, and the community pharmacy also provides primary care. However, if the condition is above the community pharmacy, the pharmacist refers to the appropriate health facility for further medical attention to be given to our client or the patient. They help in screening prescriptions, okay, and also ensure the most appropriate, that's the safe and most effective medication is given to the patient. Normally, we say that they are the first point of call in the community, but they are the last point of call when the patient comes from the hospital. Assuming there's a mistake or there's a problem with a prescription that have been prescribed by a qualified prescriber, the community pharmacy too is able to see and ask the patient to go back again for the right thing to be done. The main duties of the pharmaceutical healthcare team is dispensing of medication and giving drug-related information. All right. So the pharmacist, who normally is the head of this team, okay, checks the appropriateness of choice of drugs and the dose for each patient. So anytime any medicine before the medicine leaves the pharmacy, the pharmacist will check whether it's appropriate. Will the patient have allergies to the medicine? Are there drug interaction or drug food interaction? Is the patient on any other drug? So that the medicine that the doctor has prescribed, would there be an interaction between them? Are there foods the patient should avoid? This normally is the work of the pharmacist. Are there contraindication? Okay, contraindication means conditions under which medications cannot be taken. That's what we call contraindications. Okay, so we look at that. You look at the side effect profile of the medicine. So the community pharmacist or the hospital pharmacist does a lot of work, and that's why normally they are the head of the pharmaceutical care team. We also have another group of people called the dispensing technologists, and they ensure accuracy of dispensing and labeling. They provide information on proper storage of medication, assesses patients' understanding of prescription instructions, and advise patients on how to deal with missed doses. These dispensing technologists normally work also under the supervision of a pharmacist, okay, because the pharmacists have gotten higher training than them. They are normally HND holders. Then we also have another group of the pharmacy healthcare team called the medicine counter assistants. The medicine counter assistants. So the medicines counter assistants keep the pharmacy tidy, assist in dispensing, and also assist with purchasing. And I think for them, we've already discussed them already, so I'll not take a lot of time. Then the head of this team is somebody we call the superintendent pharmacist. Okay, the superintendent pharmacist is the head of the pharmaceutical healthcare team. For the pharmacy to also do its work and the healthcare team to also do their work, there's a need for the auxiliary healthcare team. And when you say the auxiliary healthcare team, basically they are helping, okay? So they are helping. We have the paramedics, we have the laboratory technologists, we have the radiologists, and they all perform various functions to ensure that the patient become very well. There are others that we also have them. We have the audiologist, okay, normally they have to do with hearing. They do the sound test, okay, if somebody cannot hear well. These are the people who do the implant, the hearing aids and all those things. We have the dental technologist, okay, the dietitian, disease control officer, health officers, environmental health officers, health information and record management, the health promotion assistant, technician or officer, the medical physicist, the ultrasonographer, okay, they do the ultrasounds, the community mental health officers, we have the nutritionist, occupational therapist, okay, optometrist, okay, they are different from ophthalmologist. Optometrist normally has to do the lenses. Then we have the physiotherapist, the prosthetics and orthotics. Then we have the speech therapist. Okay, so basically all this group of people help. Okay, somebody can't speak well, sometimes they have a speech impairment, it's done by the speech therapist. They all are part of the auxiliary healthcare team. Let's go at the statutory bodies that we have. Now, basically, the healthcare teams are managed by these statutory bodies. The Ghana Medical and Dental Council handle medical doctors, okay, and dentists. The Nurses and Midwife Council handles the nurse and midwife. The Pharmacy Council handle pharmacy healthcare teams. Then we have the allied healthcare professional that handle the auxiliary, and the psychological council handle our psychologists and counselors. Okay, they are all under the psychological healthcare team. Now, it is important for us to know that when it says statutory, it means that it has been formed by the law, okay, and normally by a parliament. So these organizations are formed by the law. They have power to regulate the practice of the various professions. They have power to discipline. Okay, the board members and everybody on it is appointed by the government and they work under the Ministry of Health. Okay, so these are the statutory bodies in charge of the different teams in the health service. However, the professionals may also have their own associations. Association means that the medical doctors can come together and form a group. Okay, they can elect their own president so that they can negotiate on salaries, on terms, better terms and conditions. They take care of their own welfare. They have what's called an annual general meeting, AGM. Okay, so associations are very good. Once you're a healthcare professional, you should belong to an association, and normally they help to ensure that the best interest of your profession is taken at heart. For the nurses, the association is the Ghana Registered Nurses Association. For pharmacists is the Pharmaceutical Society of Ghana, and also for MC is the Association of Medicine Counter Assistant. They call the AMGA. Okay, so these are associations that normally the healthcare teams belong to. Please let's know there's a big difference between statutory bodies and associations. Statutory bodies are formed by law. Okay, they're empowered and formed by law. Associations are a group of people that have come together. Okay, they have been recognized by the state to work. They elect their own president. They have their own code of ethics. Okay, and they guide their members. Okay, so that's the difference between the statutory bodies and the associations. Now let's get the fourth one. That's the structure, organizational structure of the health in Ghana. We have the Ministry of Health. Okay, so the Ministry of Health normally have gotten partners. It could be USAID and other foreign partners that support our Ministry of Health. Then the Ministry of Health have gotten the MDAs, that the Ministry Department and agencies, the Pharmacy Council, the Ghana Medical and Dental Council, the Nurse and Midwifery Council, all form under the MDAs. In fact, Food and Drugs Board is under the MDAs. Okay, so they are the ministry departments and agencies. They are all under the Ministry of Health. Then we have under the Ministry of Health three main sectors that form: the public sector, the private sector, and the traditional one. Then under the public sector, we had the Ghana Health Service, okay, GHS. We had the teaching hospitals, okay, and we have the also outside the teaching hospital, the quasi government institutions, and I've explained what the quasi is. Okay, partly government, partly private. Okay, sponsored by government but managed privately. Then we also have under the Ghana Health Service, okay, under the Ghana Health Service, we have the government hospitals, GHSP, the PC stand for polyclinics, and the AC stand for the health centers. Okay, they all fall under the Ghana Health Service. Now, when it comes to the private health service, we have the private medical and dental practitioners. Okay, private medical and dental practitioners, and that one you have the mission-based providers, the MBPs. Okay, the mission-based providers. Then we have the private medical and dental. Okay, they form there. Then when it comes to the traditional, we have the DTAM, that stands for the Department of Traditional and Alternative Medicines. Then we have the TMB, which stands for the traditional medical providers. Okay, then you have the alternative medicine, and the last one is the faith healers. Okay, so this is how the Ghana Health Service now is structured, and that's a structure that you should know. In pharmacy, as you can see, we all fall under the private sector where we provide our care. God bless you. I've attached some questions and I would want you to review what you've done. We've talked about the scope of the health service environment. We discussed the Ghana Health Service, the healthcare teams, and the various healthcare teams we have, and the organizational structure of the health service in Ghana. So please, you can answer this question and send it to my inbox. Okay. State the two types of healthcare, state four responsibilities of the Ministry of Health, state five functions of the Ghana Health Service, state the main sectors of the health service in Ghana, state the two major healthcare teams, state the main function of the medical healthcare team, state three members of the medical healthcare team, what is the main function of the medical care team, and the last question is state the statutory bodies in charge of the various healthcare team. Thank you all very much, and I'll come again with section D after this is done. God bless you all. Thank you.